As experts on movement, it is imperative that physical therapists understand the effects of different types of muscle contraction when dealing with their patients and their specific exercise goals. We can implement eccentric, concentric, or isometric contractions into exercise programs, but it is important to know what is happening within those muscles on a deeper level so we can prescribe appropriate exercise for our patients without causing them further harm. It has been shown through previous study that the threshold for muscle fiber recruitment decreases when the force to a muscle increases. So, the purpose of this study was to determine which contraction type requires the greatest muscle recruitment. Due to the nature of concentric loading resisting the force of gravity in the opposite direction, we hypothesized that concentric loading would require the most muscle recruitment. 8 subjects were recruited for this study, each being able to hold a 5 or 8 pound weight without any wrist pain. We decided to compare contractions within the wrist extensors and flexors due to the ease of testing. EMG data was collected on both wrist extensors and flexors using a maximum voluntary contraction as a comparison for each contraction type. 6 different tests were run: isometric, concentric, and eccentric loading for both extensors and flexors of the wrist. Those maximum EMG values were then expressed as a percent of the maximum voluntary contraction, and the mean and standard deviation were found between all 8 subjects. The resulting data is what you can see graphed here in Figure 4, with orange representing extension and blue representing flexion. We found that concentric loading did indeed require the greatest muscle recruitment for both wrist extensors and flexors, which was consistent with our original hypothesis. However, the error within our data makes it difficult to say that there was truly a significant difference. These results are conclusive with previous studies and can be used to help physical therapists prescribe exercise. For example, eccentric loading might be more effective than concentric exercises for treating things like tendinopathy. So it is important for a therapist to be aware of how to use the least recruitment for specific muscle fibers and to understand how to prescribe the most effective exercise for their patients. This study could also help therapists implement further EMG studies within their own scope of practice. Thank you.